Hello, and welcome to the online offering for Charge Nurse Delegation. My name is Mike. I'm a registered nurse working in hospital education, and I'm going to be narrating this course. Before we get started discussing and learning about delegation, here are the course objectives. By the completion of this module, you'll be able to define delegation, understand the need and benefits of delegation, describe the 5 rights of delegation, understand challenges and barriers to delegation, and explain the critical thinking process of delegation. Delegation is the transfer to a competent individual of the authority to perform a selected nursing task in a selected situation. Now remember, as a nurse, you can't delegate responsibilities related to nursing judgments to people of a lower licensure level. And in the end, you as the delegator always retain the accountability for that delegation, meaning you need to make sure that it gets done. As a charge nurse, delegation has aspects beyond just go help that patient with a bath or ambulate that patient. You may be doing a lot of different things. You may delegate tasks to help a staff member who's struggling. Hey, could you go hang those meds for that patient? You may be delegating items such as code cart checks or chart audits to different staff members throughout your shift. The important part is that by delegating these tasks, it will not only keep your unit functioning, but it will allow you to function and provide support as the charge nurse. So in your role as a charge nurse, delegation is a necessary skill. Patients are entering the healthcare environment much sicker, with more comorbidities, more complex history than in the past. As a health system, we're using more unlicensed assisted personnel, LPNs, CNAs, and such, which we want to make sure we are using them at the top of the scope of practice. As a charge nurse, you do have increased responsibility in the management of that unit. Now, your responsibility isn't just to direct patient care. Doing the tasks is not the end-all be-all of charge nurse. Charge nurse is kind of looking at the big picture, which we'll talk about in upcoming slides. And I'm sure you'll all agree, healthcare is an ever-changing environment. What we do this week can change next week, especially under the current COVID conditions. So as the charge nurse on your unit, you set the overall tempo and mood for how that shift's going to be. You have to be viewing the big picture in the care of the assigned patients. Not just the patients, but the staff who's there. You need to look at not only your unit, but how everything on your unit impacts the rest of the facility. If you're holding a discharge, is that backing up another unit, which is backing up the ED, causing the ED to go on diversion? By delaying the admission of an OR patient, are you backing up the operating room and causing delays? A lot of these things, though, you can help remedy by good delegation. You just want to make sure you're selecting the appropriate activities to delegate to the staff, and the appropriate staff are being assigned those activities. As a charge nurse, when you're delegating, make sure you clearly communicate the expectations and required follow-up to that person you're delegating to. You're going to want to follow up periodically with them while the task is being completed, and you're going to want to make sure you evaluate and provide feedback to the effectiveness of that task. So here's what you need to do. Here's what follow-up I want. Are you doing okay with that? And then, all right, you've completed that. You did a great job. Thank you. Now let's discuss the 5 rights of delegation. Much like the rights of medication administration, you want to make sure you have all 5 of these rights while you're delegating something. If any of these are wrong and you're delegating to the wrong person or the wrong communication or the wrong task, that could lead to issues in the future. We're going to go over each one of these individually. The first of the delegation rights we're going to discuss is right task. So, what can you delegate? As the charge nurse on the unit, remember when you're delegating tasks out, if it is something that requires a nursing judgment, you can't delegate it to someone who's not a registered nurse. But if it does require nursing judgment, you can delegate that to another registered nurse. Ask yourself, is there a potential for harm? And you're not just thinking about potential for harm for the patient, but is there a potential for harm for the staff member going in to do it? How complex is the task? What problem solving is required to perform the task? What is the predictability of the outcome? Does the person you're delegating to have the proper training and competence? Does the patient have any ability to assist? And does the task delegated follow a written policy or guideline? These are all questions you'll want to ask yourself. The second right of delegation we're going to talk about is right circumstance. Now, some of these look pretty similar to right task, as in, does this task require the skill of a registered nurse? Which, if it does, you need to delegate it to a registered nurse. Can the person you're delegating to safely perform this task within the circumstances of the unit and the patient? What that means is this something that they're trained on? Is this something that they can do and they can take care of, and it's something that can be handled on your unit? Are the tasks that are being delegated free from requiring independent nursing judgments? If they aren't, then they have to be delegated to a registered nurse. What is the condition and the acuity of a patient? And always be thinking about, what is your staff mix? How many LPNs or assistants do you have on the unit? How many registered nurses do you have on the unit? You can't delegate every task to the registered nurses, and the LPNs are kind of not help. You want to spread that out and figure out which tasks can go where. Right person. So while you're getting ready to delegate a task, think to yourself, can the person I'm going to delegate to, can they perform this task? But also, can they properly react if something goes wrong? If they need help, will they ask for it? You'll want to be familiar with the scope of practice of all the staff that are on the unit. You're going to want to learn about, do they not only have the proper qualifications, but do they have the experience to fall back on with a task? Sometimes this takes a little bit of time. You'll get this as you work more and more with the staff and become familiar with their skill sets and their abilities. Remember, while a new registered nurse may have the technical ability or a cognitive ability to do something, they may not have the experience to back it up and fall back on if something goes wrong. These are coaching moments. These are opportunities for additional learning with that nurse or that LPN that you can capitalize on as the charge nurse. Right communication. Communication is a two-way street, and it's one of the most important skills as a charge nurse. Clear and concise communication is imperative from you as the charge nurse to the person you're delegating to. Are you making sure that the instructions and the outcomes are clearly stated? One of the best ways you can help ensure this while you're communicating a task that is being delegated is asking, do you understand? Maybe having them repeat certain things. The key is give them a clear expectation. The best way to do this is think of the 5 whys. You're going to want to tell them what is going to be done, who it'll be done to, such as the patient in room 7, where, if it's not going to be in the patient's room, maybe they have to be moved somewhere else for a special procedure, when this needs to be completed by, this needs to be done by the end of the shift, or it needs to be done in the next 5 minutes, and most importantly, why it's being done. Also, when you're talking to someone and you're delegating a task, you might want to provide any special clinical or family information. Share those things, especially if there are certain family dynamics, such as, hey, the patient's wife is a little bit of a handful, so it may be better to do this big dressing change when they're at lunch in 20 minutes. You also want to make sure that what it needs to be reported back to you is very clear, especially if something goes wrong. And what is the outcome? When you're talking about outcome, it could just be you're going to change the dressing, their pain won't go above a level 5, come back and tell me when the dressing is complete. If there are any problems, come and tell me immediately. And remember, with communication, there are multiple ways to communicate. It could be face-to-face verbal, it could be written, it could be a message on a Voicera. Just make sure you're using the best communication so the person you're delegating to understands what you are asking and what feedback you need. Right supervision. As the registered nurse who's delegating a task and as the charge nurse on the unit, you have to make sure that the task is complete. It could be a simple, hey, did you take a report on that ED patient? Hey, did you transfer your patient? Maybe walking around and looking and making sure that the code cards were checked. But you need to provide that follow-up and close that loop and ensure the task was completed. Sometimes while you're looking at this right, you may realize this is going to require way too much supervision. And maybe that much supervision means it doesn't warrant being delegated. So, what happens when someone you're delegating to refuses to accept the task? Well, first off, go through those rights. Are all the 5 rights right? And ask the person you're going to delegate to why they're refusing that request. If they said something like, hey, it's due to fear, help correct this. Talk to that person, coach them, help them alleviate the fear. The fear might be, I've never taken a patient like that out of the OR and I don't know what to do. That's a great coaching moment as a charge nurse that you can help build their overall skill. Now, maybe they were told not to do this. If they were, you need to address that. You need to ask them who told them, why that was told, and help fix that issue. It may be a lack of confidence in a skill. I've never helped insert an art line before. If that's it, assist that person and help encourage them, help build their skill set. And maybe they're overwhelmed by workload, which asks that question. If you're delegating something to a registered nurse and they say, I can't do something because I'm overwhelmed, are they delegating properly? Are they trying to do every task themselves? If not, it's a great coaching moment to talk to them about delegation. The key is, for all these barriers listed, you as the charge nurse can address them and help that delegatee move forward in getting the task done. So, what are the reasons for under-delegating? Under-delegating tasks undermines your ability and your job as a charge nurse. Now, I'm sure we've all said these. Lack of time to delegate. Oh, I don't have time to tell someone else what I want done. Well, the reality is, when you're delegating properly, you'll have more time to get things done. The perception of legal accountability. Yes, you are obligated to make sure that the task gets done, but don't use that as a reason not to delegate. A lack of confidence in others. Every caregiver in the facility has a job description and a functional statement. If they are lacking at some level, that's an excellent opportunity to help coach and teach those staff, especially newer staff, to help them get their confidence levels up. Perfectionism, we all fall into that one. Don't fear surrendering that authority. You need to work with others and through others by delegating to get all the tasks we need to get done every day done. As the charge nurse, you're in the position you're in for your clinical reasoning, your clinical thinking, and your planning and your coordinating of the care that's happening on the unit. Not to go put an IV or check a blood sugar on every patient on the unit. Delegate those tasks out. Nursing culture causes many of the personal barriers for underdelegating. Let's be honest. Sometime during our career, we have all said at least one of these statements. Many nurses do find it difficult to delegate tasks to other members of the healthcare team. As mentioned earlier, we've all said well, I could finish it faster if I just did it myself. This is a short-sighted statement. While yes, you could take care of that one blood glucose way faster yourself than telling someone and delegating it, but if you have 8 patients, if you can tell them once and they take care of all 8 patients, that frees up more time for you. When done well, delegation can be an effective management tool and time conservation. It frees you, the charge nurse, up to attend to more complex unit needs or complex patient needs. At the same time, delegating helps to develop the skills of not only the registered nurses, but the nursing assisted personnel, the CNAs, the LPNs, the health techs, and it's more cost effective for the organization. There are many fears concerning delegation, and these fears become barriers and stumbling points. There's the concern about delegating a task improperly, violating some type of law or policy, failing to adequately supervise a delegatee, or giving something to someone who's not properly trained. We've kind of talked previously about some things you can do to help alleviate some of these fears. But the biggest takeaway I can give with this is if you do make a delegation error, don't let that lead into you just, oh, I don't delegate anymore. Learn from that error, grow from that error, be better in the future, and continue to delegate. Critical thinking is the mental activity of perception, analysis, synthesis, and evaluation of information. What you're really doing is putting together all the pieces of the puzzle to figure what could happen or what is going to happen in the future. This is a process that as nurses we use, known as the nursing process. So the nursing process and critical thinking are very similar. In the nursing process, we use assessment, diagnosis, planning, implementation, and evaluation. In critical thinking, we're perceiving, analyzing, synthesizing, making a decision, and then we're evaluating. Whenever we have patients or we're delegating or we're working on the unit, we always want to be thinking, what could go wrong? What could happen next? And if it did, what would we do? And we help figure out what we would do by using our observations, our personal experience, reflection, and reasoning. And that can help lead us to potential outcomes. So as we wrap up, let's talk about 10 steps for effective delegation. First off, remember, communication is always the key. Make sure people know what they are involved in and what the expectations are. But we want to assign tasks to those who are competent. We want to ensure the task assignment is appropriate. Set reasonable and attainable goals. Communicate clearly. Explain limits of authority and responsibility when it's needed. We want to establish specific time frames. We want to monitor the progress. We want to evaluate performance. A big key, especially when you're delegating to registered nurses, allow autonomy. And then as the one who's delegating, maintain accountability. And remember, while we're talking about delegating and we're talking about that communication, please and thank you go a long way. Delegation is another tool that you can use to improve as a charge nurse and positively impact not only the patients on your unit, but the staff you're working with. You don't have to do it all yourself. Remember that. That's what you have that ability to delegate for. Please remember to complete the delegation exercise and bring it to the face-to-face class with you. If you have any questions, comments, or concerns, please let me know. Here's my contact information. Thank you very much and have a great day.